Welcome to the Progression Health Podcast. I'm here with Dr. Amy Bender. Amy, do you want to introduce yourself to the listeners again?
Sure. Thanks for having me back. I know I was on probably a little while ago, but my name is Dr. Amy Bender. I am an adjunct assistant professor at the University of Calgary in kinesiology and also a principal sleep strategist at sleepintowin.com, which is where I do some of my consulting work with professional teams, all different kinds of athletes, recreational, college, etc.
Very good. So sleep in to win, is that like going against the grain where most people get up too early and they don't sleep enough? Is that the thinking there?
Yes, it's not the perfect name because, you don't want to sleep in too much, but yes, it kind of goes against the 5 a.m. club where people are getting up so early to just try and be more productive. But we know in the end that actually sleep helps lead to better productivity. So, sleep in to win, getting more sleep can lead to just a better performance, better mood, etc. So that's kind of where the name came from.
Very good. That's a very relevant topic. So if someone is part of the 5 a.m. club, let's just say they're like thinking about, oh, if I get up earlier, maybe they're not doing that, or they're thinking about, they currently do it. And they're like, oh yeah, I can get up at 5, no problem. What would be the issue with that? Like, let's say over the course of a month or maybe even years.
Mm-hmm. Well, we know that sleep deprivation, there's a lot of associations with poor health outcomes. Looking at even just acute sleep deprivation, I started the sleep field by working in a sleep deprivation lab, and we would sleep deprive participants up to 62 hours, so 2 full nights without sleep. And we would see those deficits occurring. We'd see greater lapses of attention, poor decision making, greater risk taking. And obviously that was acute sleep deprivation. But what we see if we look at data across time over years and years, we start to see negative health outcomes with poor or not getting enough sleep, which is really common in the US, with about 35% not getting that minimum 7 hours of sleep that each of us needs.
So what would be some of the signs if someone is sleep deprived? Like, how would they know kind of acutely and then kind of chronically, maybe they're kind of thinking I'm not sure. What would be indicators?
Waking up with an alarm every night. Like it is challenging to determine that exact number that each of us need when it comes to our own individual need for sleep. So if we start with kind of what that looks like optimally, waking up without an alarm clock is a good sign, not needing a ton of caffeine, not feeling really tired throughout the day. Those are all good signs that you're getting the right amount of sleep that you need. And if we look at kind of the opposite signs that you aren't getting enough sleep, and to be fair, this is challenging when we're sleep deprived, because one of the things we found in our studies, and we see this throughout the research, is that you have a hard time judging how you're actually doing. So when we're looking at these people who are sleep deprived up to 62 hours, their performance was tanking, and yet they felt like they were doing fine. And that's kind of a mechanistic function of our prefrontal cortex, our decision-making areas, kind of deactivated during sleep deprivation. So we don't have a good sense of judging how we're doing. So that's why it makes it more challenging, because there may be a lot of 5 a.m. club people out there who think, oh, I'm doing fine. Like I can get by on 5 or 6 hours of sleep. But in reality, if you were to objectively look at your performance, there's probably some lapses of attention. There's probably slower reaction time. There's probably riskier decision making. So it is challenging. So we all want to kind of aim to hit that minimum of 7 hours. There is some variability in there. So maybe someone needs 6.5 and they're falling asleep naturally. They're getting up naturally without an alarm. And, those are good indications that maybe this person doesn't need as much, but the majority of us do need at least 7 hours. And we're not talking, go to bed at 10, wake up at 5. That's 7 hours time in bed. That's not 7 hours of sleep. So you want to be in bed for a little bit longer than the amount of sleep that you actually need because it takes you time to fall asleep. You may wake up in the middle of the night, etc.
So how long should people give themselves in bed to sleep if the goal is to get, you said 7. So kind of I've seen that it takes roughly 20 minutes to fall asleep. So we'll say 7.5 hours. And then I'm sure there's kind of like light sleep periods in there as well. So if someone was trying to get 7 hours, would they need to give themselves 8 hours in bed? Is that how that would work?
Yes. Although we don't want to be in bed too long. So, and we can get into circadian rhythms and those kind of things. But we typically, a normal, healthy adult, normal sleeper, no sleep disorders, will fall asleep in less than 30 minutes. If you're falling asleep too quickly, you're likely sleep deprived. So that's something to consider too. If it takes you, 7 minutes to fall asleep, there could be some sleep deprivation occurring. But if you're taking longer to fall asleep, we don't want to be in bed for more time because we don't want to associate our bed with being awake. So ideally, a lot, maybe 15 to 20 minutes to fall asleep, plus 20 minutes maybe during the middle of the night. So anywhere between 30 to 45 minutes of extra time in bed in order to hit that minimum mark that you need.
Got it. And then you mentioned not having an alarm. So is it better to wake up naturally, or is there kind of side effects to waking up with an alarm?
Well, waking up with an alarm is kind of an indication that maybe you're not getting enough sleep, that it's taking that alarm to wake you up, or that the timing of there could be three main factors. Sleep duration, which we talked about, sleep quality. So we have to be concerned about the quality of your sleep as well. If you have a dog waking you up, every so often, that can be challenging and that can impact the quality of your sleep and your ability to get into deeper states of sleep, for example. But also the timing of sleep is important. And so if, for example, you're a night owl, but you're having to wake up at 6 a.m. to get to work on time, that's a sign that ideally we want to try and shift that schedule later. Now, typically that's not possible. We all have to get up for work. So there are some things we can do to help shift our circadian rhythms and help our biology be more aligned with our sleep schedule. And one of the keys for that is actually getting lots of light. So light is the biggest effector, I don't even know if that's a word, of our circadian rhythm. So light in the morning is going to help set the tone. It's going to help tell our brain it's time to wake up. Let's get rid of that melatonin. This is the day. So light in the morning is important. It helps set our circadian rhythms. It helps strengthen our circadian rhythms. So those people who spend more time outside, when it comes to bedtime and they're looking at an electronic device, it's not going to have as much impact on their sleep quality because they've gotten all this light across the day, which is going to help improve sleep quality at night. So those are some things to consider.
It's funny. You're making me think of I'll go to the movies at like 4 p.m. in the day, but because it's so dark, I'll just nod off. Is that related to my circadian rhythm and how my body thinks it's nighttime and I'm going to sleep, or is that something else?
It could definitely be related to that because no matter the time of day, and of course there's certain times of day when we're more alert according to our circadian rhythms. Typically, mid-morning, 10 a.m. we're really, and it depends on your circadian rhythm. But 10 a.m. is a really, really alerting time. Post lunch is actually a very kind of sleep promoting time. And then once we get into, 7, 8 p.m., actually there's a peak in alertness. However, it's not just about our circadian rhythms, but it's also about the sleep homeostasis, or how much sleep you've gotten and how long you've been awake. So the longer we're awake, the more adenosine builds up in the brain, which is our sleepiness hormone. And so it's kind of the combination between circadian rhythms, how much sleep you got, how long you've been awake, helps determine when we're sleepy and when we're alert throughout the day. So the 4 p.m. example, maybe you didn't get a lot of sleep the previous day, or it could be just a time in your circadian rhythm where that's kind of your low point during the day. And when we think about that, our environment does make a difference in how well we're sleeping and how the quality of that sleep. So we do want a good environment when we're preparing to go to sleep. We want to dim the lights. We want to put those electronic devices away. We want to have, noise canceling earplugs, just no noise in general. And those things help us prepare us, give us the best chance for sleep too. So, yeah, a lot of different factors, circadian rhythms, sleep homeostasis, how long you've been awake, but then also the environment and the light that's in your environment can help facilitate sleep or
Yes, so
wakefulness.
many. Yeah, so many different factors, and as well your sleep that you've gotten the nights beforehand as well. So with the sleep in to win, what work do you typically specialize in there?
Yes, I've been doing a lot of work with some professional teams. I was recently actually at the NBA draft combine. So they had a health and performance meeting for a lot of their health practitioners, their high performance directors, strength and conditioning coaches. So that was really interesting to be a part of that. And we had a panel talking about sleep and what to do in the NBA. So that was really interesting. And I'm doing something similar for the NHL coming up at the end of next month. But yeah, some work with just educating athletes on the importance of sleep, which is important. We want to know why should I be getting a good night's sleep? Why should I be prioritizing this? And so really speaking the language of performance, how sleep relates to performance, with improving reaction time, improving sprint times, improving decision making, for example, is kind of the first step in education. But then doing work one-on-one with individual players, like how do we optimize sleep in this particular scenario with these problems that they're having? So for example, I hear a lot of having troubles falling asleep after a game. So I kind of create techniques and a plan to help address that. And then travel schedules is a big theme as well when working with these groups. So they're crossing multiple time zones. They're wondering, they may have back to backs, and they're wondering, should we stay after the game at that location, or should we get to the destination as fast as possible? So doing some interesting work with that, and working with a fabulous CEO at Archoscope who does a lot of mathematical modeling. And she's done a lot of work with shift work. And when should these shift workers be getting light exposure to help shift their circadian rhythms to a more optimal time when they're working? What should they do on their days off? And so she's done a lot of modeling in that regard. And what we're curious about now is, what does this look like in the NBA? And what happens when we plug in a schedule, an 82 game schedule? What does the model look like if they stay over on this day? Or what does the model look like if they arrive at their destination at 4 a.m? So definitely some interesting work in those areas at the moment.
Very good. So yeah, with travel, like I'd have clients who'd obviously travel, and is it almost guaranteed that your sleep's going to be disrupted when you travel, or can people kind of maintain the same sleep rhythm? And I don't mean crossing over time zones. I just mean kind of like, or maybe traveling within kind of the US where it's not, a transatlantic. Is there ways to maintain a consistent sleep schedule even with travel?
Well, if you look at the research, actually, when we're sleeping at a new location, our brain is more awake when we're at this new location. So it's really interesting in that regard. So definitely on that first night when we're in the new location, you'll likely not have as good of quality sleep as you normally would. But there's ways that we can try and mitigate these issues. Um, Preparing, having a good pre-sleep routine, which you do at home and you also do on the road when you're in this new environment. Bringing an eye mask, bringing earplugs, setting up your environment for sleep. And just doing relaxing activities before bed, putting those electronics away. Actually have a good Instagram video, which I do need to update, where I talk about sleeping in a new environment in a hotel. So maybe we can link that to have people check it out.
Yeah, absolutely. Anything to make sleeping when traveling easier would be a great help. So just in terms of adults in the US currently, do you know any of the statistics around, how much adults sleep and, how well do they actually sleep, compared to the recommendations?
Yes, it looks like about 35% of Americans are not hitting that minimum of 7 hours of sleep per night. So about a third of us out there are sleep deprived. And much of that population probably has some sleep disorders as well. So about 10% of adults at this point could be diagnosed with insomnia. So having poor or having an inability to fall asleep in a reasonable time, potentially waking up during the middle of the night. So there's insomnia going on within those people, as well as sleep apnea. So is another very common sleep disorder where you stop breathing during the middle of the night. And a lot of times people are unaware, especially with sleep apnea in particular. Maybe a partner will notice them snoring or stopping breathing during the middle of the night, but the person themselves may not be aware as to how many times this is occurring. And I've seen cases where someone's stopping breathing 80 times per hour across the entire night. So it's a very serious disorder that we want to get checked out from a sleep professional and get treated to help in that instance. So yeah, a lot of us really struggling. And then, that doesn't even include subclinical areas where, someone may not meet the criteria for the disorder, but still their sleep quality could be impacted. So it's a big problem. And there's even some statistics on that the US economy loses 411 billion annually due to sleep deprivation. So this really impacts absenteeism. So, the more sleep deprived you are, the more likely you are to be sick, call in sick to work, mental health, impacts also presenteeism. So you're at work, but you're not really doing much. You're not very productive. So it is a really big problem. I think that where I think it's becoming more well known about the importance of sleep, why we need to prioritize it. So I feel like we are potentially on the right track. At really creating awareness of the importance of sleep.
Yeah, if anything can get people to think about their sleep more and ways to sleep better, we can make a dent in that 411 billion deficit. So just on sleep apnea, I've heard, I think from what I've seen, it's more common than people think. And, snoring could be connected to it. So what exactly is happening when someone has sleep apnea, and just like, what are some of the side effects of that condition?
Mm-hmm. Yes. And I think I thought it was around 20% of people out there have sleep apnea, and across the entire world, it's something like 1 billion people are actually untreated according to some of these estimates. So it is a very prevalent condition. It is more likely to occur as you get older. So people in their 50s have a higher likelihood of having sleep apnea. It's more likely to occur in males, and it's more likely to occur if you have a higher BMI because of the kind of fatty tissues that could be blocking the airway when you're sleeping and don't have a lot of control over those muscles. So those are kind of those people who are at risk. However, I've seen women, I've seen, younger women, I've seen people with a lower BMI have sleep apnea. So it can occur in really anyone. And there are, again, same with sleep deprivation, there are a lot of associations with negative health outcomes. So higher risk of diabetes, higher risk of cardiovascular disease, of stroke, of Alzheimer's. So it's really important that we get that treated. And the gold standard for treatment right now is continuous positive airway pressure, so CPAP. So that's kind of that machine you wear during the night that opens the airway. It just takes kind of room air and it helps open the airway with air pressure. A lot of people aren't a fan of that. And so I like to tell people there's alternative therapies out there. So there is oral appliance therapy that can make your airway more open during the night. So you wear a mouth guard that helps keep your airway more open. There's therapy where they can actually do surgery to help increase the airway. And also there's this new therapy called Excite OSA, where they do muscle electrical stimulation of the tongue, which helps strengthen and opens the airway. So there's a lot of alternatives out there, and there's probably a lot of people out there that tried CPAP and have not tolerated it very well. But just to say that it's important to get this condition treated and that there are alternative therapies besides CPAP.
Yeah, I've heard about the CPAP, and the majority of people I've heard it discuss about their experiences that they didn't like it. So it's really good to know there's other options out there.
Mm-hmm.
So you had a really interesting post on Instagram on your page about time spent outside and its effect on sleep quality. Could you just tell us a little bit about that post and what did you find in the research?
Yes. So we had a study where we had about 20 people. So kind of a pilot study, I guess you could say, a smaller type of study where we had 20 people wear EEG across 20 nights. And we were looking at their lifestyle factors on each of these days and what their sleep quality looked like at night and then also looked at performance with a reaction time test. And what we found was that those who spent more time outside actually had better sleep quality at night, and then subsequently in the morning had better performance. So they had less lapses of attention. They had, I believe we found faster reaction time as well. And we found that about 2 hours plus. Now, we basically asked someone, did you go outside today? And then we asked them, for how long did you go outside? And then we had to kind of put those into categories. And what we found was that 2 hours and up showed really great benefits when it came to performance the next day versus someone who only got 30 minutes and up to 60 minutes. So it's looking like, the more time you can spend outside. Now, at least in this study, the way we analyzed it, it was 2 hours and up. The better sleep quality you would have at night, and the less lapses of attention and better performance the next day.
Interesting. So, how did you define lapses in attention, or, what kind of testing was done?
It was an app that we used. So it was called Vigilance Buddy. And it was an app that basically, it was a 2-minute test, and a stimulus would come on the screen and you had to just press your screen as fast as possible. And the way that we define lapses, because it was such a short test, we define lapses as greater than 355 milliseconds. So normally you define it as 500 milliseconds or greater, which is a half a second. So, basically anytime someone took around a half a second to respond, we considered that a lapse of attention. And we were tracking that throughout this 2-minute test, and then looking to see how those lapses of attention, like how was their sleep quality the previous night, and how much time were they spending outside on the previous day.
Got it. So then, just looking at the graph itself, so is it fair to say that like 60 minutes is the sweet spot for time outside, or is 120 minutes better? Is more better? What's your opinion?
If you look at the data, so we did not find a significant difference between 61 to 120. So that was one of the categories, and then 121 and up. So we did not find a significant difference in lapses with those two categories. So you could, and of course, this is kind of extrapolating and maybe making a conclusion that may not be replicated in the future, but it looks like if you're getting at least, and this was 61 minutes technically, and up, it did provide those kind of performance benefits if you look at this graph pretty closely. So again, the timing of this time outside, we didn't get super detailed as to when this timing of time outside was occurring, but we did ask, was it occurring primarily in the morning, afternoon, or evening? We didn't really find much of a result there, but again, it wasn't very detailed as to what that looked like, and they could have been, let's say, doing 30 minutes in the morning and 31 minutes in the afternoon, and then they would put that their time outside was mostly in the afternoon. So there's a lot of ways I think we could optimize this research going forward.
So then that makes me wonder about, the activities outside, and like what were people doing outside? So for example, like if someone was walking or doing like running, or just having their lunch outside, did that affect the sleep differently than, other activities?
it's a really good question. We did track exercise on its own to see how exercise influenced sleep quality. We didn't find too much there. But it could have been that like exercise on its own. And this was a small study, so we can't, it's hard to look at the interaction between exercise and time outside and when timing of that light exposure as well. So it was a smaller study, so it was hard to look at some of those interactions. Um, but kind of thinking about some of our other results as well, we found that the timing of caffeine made a difference. So those who were drinking within 4 hours of bedtime tended to have poor sleep quality and poor performance the next day. I'm trying to think of some of the other results that we found as well. Social media use. So we found that those who are more likely to use the internet or use social media in the hour before bedtime had slightly worse sleep quality than those who weren't doing that. And a lot of times, if we're looking at wearables with a ring or a wrist worn device, that's not actually measuring brainwave activity. And in our study, we were looking at brainwave activity, which is much more sensitive to kind of detect some of these changes. So a lot of the previous research would indicate that you can use an electronic device before bed, no problem. It's not going to impact your sleep quality. But the way they're looking at sleep quality is through, an actigraph, wrist worn, movement, etc. So, I think that's the strength of this research, but of course, more replication needs to be needed for sure.
So in your opinion, if somebody works like, a 9 to 5, they work from home or in an office and, they don't get a whole lot of time outside, what would you recommend to someone who's like, my sleep, I think it could be better, the quality or duration could be better, and I'm willing to spend more time outside? What would your recommendations be for time spent outside?
I would say, can you get outside during a break in the morning? Can you, maybe walking the dog? Can you commute to work? I mean, some of these may be unrealistic depending on your situation, but could you bike to work? Could you walk to work? Could you walk on your lunch break? Um, Trying to find ways to kind of naturally fit in the time outside and the movement and exposure to nature activity, I think is great. And I think it could really make a difference if you're stuck inside a lot. It could really make a difference in your mood, number one, but also your sleep quality. Even like they found for those, they've compared sleep quality in office workers who have a window versus those who don't have a window, and those who do have a window sleep better at night. So even like, can you adjust your working location? I mean, I know that's hard if you're in an office, but if it's like a home office, or can you maybe do some work on your laptop close to a window? Those things can all make a difference. So if we can start with some of those activities, you might see a great improvement in your overall sleep quality, because our our brain needs to know when it's daytime outside. And I'm actually, my office is kind of in the basement, and so I actually have low light levels. I think if I look at the lux, or the quantitative way of measuring the brightness, I'm at about, well, let me just check right now. I'm probably at about 100 lux or so. Here, I'm going to look right now. Okay, I'm at about 200 right now. So even adding artificial light to your environment during the day could be beneficial. We're not designed to be in a cave during the day. So trying to get any kinds of light exposure, and that may even be artificial light exposure, can really help improve our sleep quality.
Yeah, I definitely feel like in my experience that's the case as well when I spend time outside during the day. So I definitely would recommend people try and get more sunlight in their day if they feel like their sleep can be improved. So, Amy, you mentioned mood and a little bit of mental health as well. What effect does, sleep and getting enough or not getting enough have on things like anxiety and depression, kind of like maybe in the short term, but also in like the long term?
hmm we did a study in it was over 20,000 people. In my previous role, I was working at Calgary Counseling Center, and so I was part of the leading the research team, and we were really interested in the relationship between sleep and mental health. And we did a survey in these people, and we're just looking at a a validated questionnaire when it came to depression. And so we had this validated questionnaire that we asked them as it related to depressive symptoms. And then we asked them, how much sleep are you getting? And so we did find kind of a U-shaped relationship where those who had high levels of depression had lower amounts of sleep and also higher amounts of sleep. So, and these are associations, and basically our sweet spot. So the lowest amount of depressive symptoms in relationship to sleep was about 7.5 hours. And that was kind of that sweet spot for lowest amount of depressive symptoms, which aligns with what we see for recommendations of sleep, et cetera. Now that was just, associations looking at these relationships, but further work has gone to show that poor sleep can lead to poor mental health, but also, reverse that where, poor sleep leads to poor mental health. Poor mental health can lead to poor sleep as well. So it's a tricky kind of relationship. But if we look at those sleep deprivation studies that I was talking about, the number one impairment that we see, or the number one complaint, is problems with mood. So there is something there in that if we aren't getting enough sleep, if we're getting poor quality sleep, that we do see more mental health issues in those individuals.
Got it. Yeah, that's interesting to figure out. It's like a chicken or the egg situation, but yeah, you can't really cut corners on sleep. So it's always best to try and focus on the controllables and get as much sleep as you can. So another post you had on your Instagram was around the Oura ring. So, I hear a lot about it. Oh, it's like science-based and it looks really cool, but how accurate is it? Is it more accurate than other wearables? And like, would you recommend people wear it to track their sleep?
hmm I think in most situations, it's important to have some way of tracking your sleep. Now, that doesn't have to be with a wearable device. It could be you wake up in the morning and you rate your sleep quality, or, on a piece of paper. It doesn't have to be high tech, but I think I kind of go back to, what's measured can be managed. So if we're not measuring something, it's going to be really difficult to manage it. And so that's kind of the quote that I go back to. So I think wearables provide a lot of benefits. It helps bring awareness to sleep. And, Oura Ring has definitely, with their millions of users, have definitely brought more awareness to sleep and the importance of sleep. And I would say, there are big differences between some trackers and other trackers. And I would say Oura is definitely a good option when it comes to choosing a sleep tracker. Fitbit Alta is also another option. Whoop is right there as well. Garmin is actually kind of on the poorer side at this point, so they're not as accurate as some of these other wearables. But uh, as I said, I think it's helpful in most situations. However, there can be what's called orthosomnia, so the obsession with getting a good night's sleep, looking at this data, having it impact you potentially in a negative way if you see a score and you're like, oh no, I'm going to have a horrible day today. Um, and so we have to be cognizant of the benefits of when these trackers do well, when do they not, what data do we trust from these trackers, what do we not, and at least right now, we can trust the sleep duration that are coming from these trackers. That data has been shown to be pretty accurate when it's compared to in the lab with EEG and all of these other sensors. So sleep duration is pretty accurate when we're looking at most of these devices. Now, when it comes to sleep, well, I guess deep sleep is how they're defining this, REM sleep, light sleep. It does a poor job of kind of accurately capturing those instances. And so, for example, I think I have a post on my Instagram where I got 8.5 hours of sleep and it showed that I only had 4% deep sleep. And which is, if I was in the lab, so I used to score all these sleep studies for different sleep stages. And if I was hooked up in the lab, I can guarantee that my deep sleep would be more than 4%. So we have to be kind of aware of the weaknesses of these devices. And I know Oura Ring is getting better with their algorithm detection. They probably have one of the best algorithm detections when it comes to parsing out deep sleep, light sleep, REM sleep. Although it's not like you're in a lab, it's still a bit inaccurate. And my thought would be just because I have, let's say it shows I got 33% deep sleep. Is that a good thing? Well, when you're sleep deprived and you have recovery sleep, you have more deep sleep. So it's challenging to really understand, even if this data was accurate, is it really making like life-changing insights into how I should change my habits to improve sleep quality? I think that's a bit of a missing link.
It makes me think of if there's, someone with just spare cash around to do a study comparing people with wearables versus without, and if the wearables actually help to improve people's sleep. So hopefully something like that comes out down the line to tell us. But
That is a good point. Are these even, it's kind of like I kind of equate it with bathroom scale. It's not a weight loss program. It's measuring how much you weigh, but it's not giving you insights on what to actually do to lose weight. I kind of equate wearables right now, sleep trackers at this point in a similar way. It's measuring, but is it really making a difference in your overall sleep quality? Who knows?
exactly, yeah, we got to objectively analyze, is it helping? And it's interesting you mentioned Garmin isn't particularly good compared to the other companies there, because I have a Garmin watch and I was tracking my sleep a couple of months ago. And at a certain point, I had to take away 30 minutes every night, because the minute I got into bed, the watch thought I was asleep. And I'm like, no, I definitely didn't fall asleep at that time. And so, yeah, that it checks out in my experience.
That's funny. I think that study where they were looking at Garmin showed on average like 52 more minutes of extra sleep that wasn't really there. So that also aligns with your experience.
Wow, it's a lot. It'd be nice to get an extra 52 if I could. So another thing that affects sleep in my experience is coffee. So, what's your opinion on coffee? I think the last time we talked, you said you stopped drinking coffee. I think I just hit 30 days no coffee. I have a bit of caffeine and I definitely anecdotally feel like I'm sleeping better, but I haven't compared what the watch has said. So, if you're working with somebody, what do you recommend around coffee and their coffee consumption?
hmm I mean, to drink it strategically is kind of my main piece of advice. There's versus automatically. So, there's been some research to show actually, if you're looking at in athletes specifically, and you categorize athletes into slow metabolizers of caffeine versus fast metabolizers of caffeine, and you give them caffeine before a cycling time trial about an hour before, those who are actually slow metabolizers of caffeine perform 14% worse than when they didn't have coffee at all. So there is a lot of nuance to this recommendation that we should all automatically drink caffeine for every amazing, competition that we have. I think we should be a little bit more thoughtful as to, does this really help me in my performance? There was a recent meta-analysis, so that was looking at 24 different studies on caffeine and sleep. And they found that with caffeine consumption, it reduced total sleep time on average by 45 minutes. It decreased sleep efficiency by 7%. So basically a measure of kind of sleep quality. And it increased the time it took them to fall asleep on average between 9 minutes. They had 12 minutes more of wake during the night than when they weren't drinking coffee. And interestingly, they found that they were looking at actually the type of caffeine that they were using, and they found that coffee should be consumed at least 9 hours before bedtime, in their experience. So if you go to bed at 10 p.m., you want to finish your caffeine consumption by 1 p.m. And they actually looked at a pre-workout supplement, which some of your clients may be actively taking. And they found that pre-workout, standard serve of pre-workout supplement, so around 220 milligrams of caffeine, should be consumed at least 13 hours prior to bedtime. So that's more like a 9 a.m. Scenario there in this particular study. So caffeine, it can, as this study has shown, and as we all have probably experienced, can have a negative impact on our sleep. And there are people out there who think, it doesn't affect me. I can have an espresso at 10 p.m. and I'll be fine. But it's probably likely impacting the quality of your sleep. You just may not be aware of it.
That is fascinating. 45 minutes a night. That's huge. So I think if we told people, sure, you might be more alert if you drink coffee, but you'll lose 45 minutes of sleep, people would say that's a terrible deal. And it's just one night as well. That's wild. So I'll have to link that study in the show notes.
Yes. Now, it's likely not as bad as what I'm telling you here, because it was likely that these people were off of caffeine and then had caffeine. And so it probably exacerbated these results. Whereas if you normally drink one cup, at 8 a.m., having an additional cup, or where this really makes a difference is if you're on coffee, you've had it for a while, you go off coffee for a while, then you try it back up again, it's probably going to have more of a negative impact versus someone who's just kind of continually consuming 1 to 2 before a certain time of day. So, don't want to mislead people there, but definitely something to keep in mind and how it impacts you specifically.
Of course. And like you said, the timing as well is very important. So someone could have the one cup earlier in the day and they might actually not lose any sleep. So the 45 minutes definitely an exaggeration.
Mm-hmm. Mm-hmm.
Amy, that's all the time we have, but it's great to chat to you. Is there any final message you want to leave people with or links you want to tell people about?
Well, I'd love to, for those people who are really struggling with your sleep, definitely try and reach out and get help from a sleep professional. I think it could really make a difference. And even if you're struggling for 10, 20 years, like you can still kind of turn that around and definitely don't hesitate to reach out and get help from a sleep professional if you are really struggling with your sleep. As far as ways to reach me, you can catch me on Instagram and Twitter at Sleep for Sport, and then also my website, sleepintowin.com.
Brilliant. I'll attach all that in the show notes. Thanks very much, Amy.
Thanks for having me. It's been great.